Hi everyone, my name is Deanna and I work at the Lake Success and Wantagh offices, and I'm here for this Tuesday and every Tuesday in January to discuss and provide you with tips for targeting speech and language therapy at home. Today I will be discussing a few therapy strategies that parents can use when working with children who demonstrate echolalia. A child who uses echolalia often repeats or imitates what someone else had just said. For example, if a parent asks their child, "Do you want a cookie?" and the child responds, "Cookie," instead of saying yes, then they are using echolalia. There is also a type of echolalia called delayed echolalia, and this is when the child repeats someone they have heard before, even though it was not something they had just heard. There may be a delay of minutes, hours, days, weeks, and even months. A good example of this is children who love to quote TV shows, movie scripts, their favorite book. These are children who are definitely exhibiting delayed echolalia. So, echolalia is very normal and part of language development, so children who are learning to speak are always using this. Let's say your child loves to take baths, and you ask them if they want to take a bath. The child will consistently say, "ba, ba, ba." This child is probably still working on final consonant sounds and still working on their ability to answer yes/no questions. So instead of the child saying yes, they are going to repeat the last word of it. This is how children learn language, repeating what they hear around them and eventually using their own utterances to speak and repeating others less. However, there are some children who don't move past this echolalia stage. So the child will not come up with their own utterances and they will continue to repeat what their communicative partner has said to them. This child might be experiencing difficulty learning language and could possibly have a language delay. However, there are strategies that can be used at home to help alleviate your child's echolalia. First, if a child is still using echolalia, who is over 3 years old, they may not have strong enough language skills, so they are repeating what they hear. Parents at home can target their language skills that their child is struggling with and treat those skills instead of the echolalia directly. Give the child the tools and strategies they need to help emerge their language skills. So for example, let's say if the child does not know enough words to spontaneously use them to request, a parent can then work on building the child's vocabulary. They can be done by labeling household items, clothing, food items, or any of their favorite toys around the house. Giving the child the resources and the tools first to use their language skills in hopes that the echolalia decreases and their language skills increase. Another strategy you can use at home is working with your child who is echoing to request. Often, children who are echoing don't really mean what it is they intended to say, they are just echoing what it is they heard from other speakers around them. To work on this, you can model the correct sentence for your child to repeat. For example, if your child says "hold you," you can then model for your child, "Will you hold me?" or "hold me," and encourage your child to repeat it back to you. After this, you can then respond to what your child is actually saying so they know that's not what they intended to say. For example, if your child says, "Do you want a ball?" and they really mean, "I want a ball," you can then say, "No, I don't want a ball, but you do. Say, I want a ball," and then have them repeat it back to you. This starts to bring their awareness back to them that what they echoed is not what they are meaning to say, so they just don't know the words to say it. So you can give the child phrases or sentences of what they should say and then start responding, such as, "No, I don't want a ball, but you want a ball. Say, I want a ball," and then have them repeat that back to you. So these are just some tips and strategies that you can use at home when working with your child who is echolalia.